All right, so first off, I'm going to toss the mic over to Brian Dillard, our Chief Innovation Officer, and Zan Gibbs, our Chief Equity Officer, to give us some opening remarks.
Awesome. Thanks, Leslie. Can you all hear me okay? Excellent. So yeah, first of all, I want to say thank you to everybody that's joining in on this conversation and participating. It's very important that we do get your participation. It's really the point of these community conversations. I also want to thank, I'll kind of do the thank yous. First off, thank you to Geekdom and our CivTechSA team for putting this type of event together. You know, this is one of the ways that CivTech, that the city of San Antonio and Geekdom work together, CivTechSA, to provide these type of opportunities for residents, for businesses, entrepreneurs, startups, and honestly, just good, healthy conversations. I also want to thank our esteemed panelists, of course. There's a lot of PhDs in the virtual room here, so I feel dumb. I want to thank our Metro Health Department. Without them and their allowance to have this conversation, you know, we'd be kind of left high and dry. So we definitely thank them for, you know, showing that humility along the way to say that, hey, let's bring our residents in and let's figure out how we can do better. We already know we're doing great, but we can always do better. So kudos to them. Thank you to Zan Gibbs and our Office of Equity for being our guiding star when we talk about these kind of conversations around equity. Definitely a good influence for us. And then last but not least, thank you to our council, mayor, and of course our city management for allowing us to have these kind of conversations. Again, these can kind of be uncomfortable when you're asking people to point out your flaws and help you solve for them. But city of San Antonio is a different kind of beast when it comes to that. So I'm excited about that. So as we talk about this conversation, what in the world are we doing here? Well, Emily's always been pushing me and about systemic change starts with data. And so that's what we're here to discuss. Public health data is definitely not something you think about when we talk about data. Everybody thinks it's all about technology and whatnot, but it's really about human interaction and what we're gathering from our residents. So when we talk about data collection, we're talking about three kind of approaches. And when we're talking about data, we're talking about three kind of approaches. So one is data collection. So data collection in that regard is really kind of surveys that you may get as a resident from the city of San Antonio or an agency. How are they surveying? What questions are they asking? Are they asking the right questions? Are they asking questions that are applicable to you and your background? Also kind of medical information. So if you go to a doctor, you go to a public health facility, what kind of questions are coming in those forms that you're getting? So that's really a data collection piece. Second piece of this is data processing. So right now we're transitioning very quickly from, you know, a lot of human interaction with public health data to some opportunities for machine learning and AI to be embedded in this. What does that mean for our general resident? Do our general residents understand what implications come along with that and what kind of protections we're trying to embed into that? The third piece is the utilization. So we've collected the data, we've processed it. Now, how do we use that? So a lot of this goes into a lot of policy making and identifying what services need to be provided in which communities to which residents. This is all very important. That's really what we're talking about here throughout this three-part series. So today's conversation is obviously going to focus in on identity. So how do we identify through this data? How do we identify residents? How do our residents identify themselves and how are they counted? So that'll be today's conversation. The next one, next week will be about reach. So how do we identify the barriers to inclusiveness when it comes to us gathering that data from our residents? How do we make sure that digital divide or racial barriers, income barriers don't block that approach? And then the third part of this conversation is going to be about trust. So when we talk about that data processing, you're handing my data over to machine learning. How do I know that the person that set up that machine learning, that automation, isn't biased themselves? So these are all conversations that we're going to have over this three-part series. I'm very excited for the outcomes. I'm definitely excited to be learning. You're probably wondering, what in the world does this have to do with us? You got PhDs all through this room. You got smart people working at the city. What do you need me for? Well, the city can't assume that we represent all. We cannot assume that our backgrounds are reflective of everybody's in the city. So that's why your input, your injection into this conversation is very important to us. You guide the conversation. That's why we're here, and that's what we hope to gain from this these three-part series. So not only tune in today, if you're watching the recording, tune in next week and the week after that, watch the recordings, and definitely provide feedback to us as we move along and allow us to improve this conversation. Thank you, Leslie. Thank you again to everyone participating today.
Thank you, Brian. That was a great introduction. My name is Zan Gibbs. I'm the Chief Equity Officer for the City of San Antonio, and I'm really excited to be here with you all today in this virtual room, as Brian said, of really smart people. Very excited to hear the panelists today. And identity and data is sort of the cornerstone of the work that we do at the Office of Equity. So our whole job is to eliminate disparities that exist in community in San Antonio. So we are a very data-driven office, primarily looking at racial disparities and economic disparities. So we know that in San Antonio specifically, disparities are, as I like to say, vast, wide, and deep. We have huge racial segregation, we have economic segregation, and then we also have disparities by identity. So you know that your identity can actually predict your outcome in San Antonio as it can all throughout the United States because of sort of systems of oppression, systemic, historic, and present day racist policies that really change sort of your ability to be sort of successful in your outcomes, and not everybody gets to start from the same place. So to that end, we always look at data from an identity perspective, and we ask departments to disaggregate their data by race, by identity, by gender, so that we can really see what the work that they're doing and how it may be transforming outcomes in community, ideally to improve outcomes in community. So we used what's called results-based accountability methods with many of our tools, with many of the departments, so that they really can sort of track their progress and measure their results towards eliminating these disparities. So you need data to even know where we're starting. We need to know what are the present day disparities. We have a couple tools on our website that we use regularly to sort of help track disparities and ideally move the needle forward towards progress and eliminating the disparities. One of them is what we call an equity atlas or an equity matrix. So we just map out census data. So you can see by census tract in San Antonio where people live, where there are concentrations of poverty, what are sort of the educational attainment outcomes by census tract. And then we also have a deeper dive report that's our racial equity indicator report. That was a very large report that we funded last year with the help of Community Information Now. In addition to, we received some funding from the Robert Wood Johnson Foundation to really take a deep dive into what are the racial disparities in San Antonio as it relates to outcomes. So for example, you can see outcomes by health, outcomes by transportation, outcomes by home ownership in San Antonio, all disaggregated by race. So this gives us a really good sort of starting place for where San Antonio is as it relates to outcomes and where do we really need to move the needle. There's definitely bias in outcomes, and health is, you know, definitely a huge part of this. We know that health outcomes were already worse for low-income folks and folks of color prior to the COVID pandemic. The COVID pandemic is only going to make those outcomes worse. So we really need to address data and equity and bias head on in all of our work so that we can really ensure that the work that the city is doing and that the community is doing is really focused on improving outcomes and advancing equity. So I'm really excited to be here today and looking forward to hearing all the brilliant folks speak on this. So I'll hand it back over to the moderator, and thank you again.
Awesome. Thank you so much, Brian and Zan. That was such a wonderful kind of deeper dive into why we're here, all the things we're working on to kind of, again, just move this needle forward. It's time. It's been time for a while. So we're really excited about that. So before I introduce our official moderator for the rest of the event, I did want to mention that we are going to be putting a health priority survey on the CivTechSA website for everyone to interact with. So you guys can kind of get an idea of a full case study and view of how a survey has been conducted to the public with Metro Health in the past. And we want you to look at it and we want you to see, you know, where is some bias? Where could we have done better? So stay tuned for that. We are working on getting that up, and there'll be a follow-up email, lots of social media posts, or it'll be on our website with a big old banner for y'all to go interact with. So keep an eye on that. We're really excited about that piece as well. So now I'm gonna toss the mic over to Miss Emily Royall. She's from the Office of Innovation as well, and she's gonna moderate our panel today. And Emily is our smart city administrator for the Office of Innovation. So she's always kind of knee deep in all this stuff. And she's also very much a data queen. She loves data, all things data. This is totally her wheelhouse. So we're really excited for her to hop in and lead us through our panelists today.
Thank you, Leslie. So Smart City Administrator would be a promotion for me, just to be fair. I'm the Smart City Coordinator for the Office of Innovation. And I just want to welcome everybody today to this conversation that's focusing on identity in data collection methods in particular. We have 3 panelists today who all have tremendous experience in how to design more inclusive data collection tools that better reflect the identities of our community, including marginalized populations and communities of color. As we listen to each of them speak for a few minutes, I want to pose a few questions for folks to keep in the back of their minds. First, how do we ensure that we have fair and equitable representation in the data that we use to allocate critical services? When data is collected from our community about our community, it's used to target services, not just by the city, but also in private industry as well. So I want people to think a little bit about how can we better represent our community in the moment of designing a survey, of designing a field for you to select your identity, whether that's gender, whether that's sexuality, whether that's race, ethnicity, etc. So I'll introduce each of our panelists first. Hold questions, you can put them in the chat, and I'll select a few at the end of all 3 presentations. So let's hold our questions for each until after all 3 have been able to go. First is Dr. Allison. She is a physician scientist, an assistant professor of infectious disease at UT Health San Antonio, and medical director at the San Antonio AIDS Foundation. We're so lucky to have her join us today. Dr. Allison believes that healthcare is a human right, and her work focuses on improving access to healthcare for underserved and marginalized populations by combating disease-specific racial, cultural, gender-based, geographical, and economic barriers to healthcare access. She is the principal investigator and program director of a multi-million-dollar U.S. federal health resources and services administration, funded the special project of national significance for curing hepatitis C among people of color living with HIV. So special welcome to Dr. Allison. Let's just kick it off there. So Dr. Please share with us some of your thoughts and reflections on this.
So thanks so much for having me today. It's a real honor. I want to talk a bit about public health data bias and its contribution to health inequity. So it's almost a presumption with regards to identity that to limit inequity, to level the playing field, the most important public health data to collect on identity is race, ethnicity, and gender. Identity, though, is who we are. And who we are is so much more than just our race, our ethnicity, and gender. Those things are very, very important, don't get me wrong. It is very important that we track data not just by race, because race per se is not the reason for the disparities that we see, but it is the disparities that we see, as was alluded to in the introductions, are due to structural issues, right? Structural issues related to poverty, power, access to healthcare that disproportionately affect people of certain race, ethnicity, and gender. So I want to take two examples. The first obvious example is the COVID-19 current pandemic, which disproportionately causes mortality, death, and morbidity, sickness in Black, Latinx, and Indigenous Americans. The public health data that needs to be tracked is, yes, race and ethnicity, but also what's really important is, are you an essential worker? Do you have paid sick leave? Do you have running water in your home? Do you have childcare available? These are the things that lead to the inequities that we are seeing within the COVID-19 pandemic. The second example I want to give, which kind of alludes to, reflects data processing and how we use data, and that was also mentioned in the introduction. A paper was published in October of last year by Obermeyer and colleagues in Science, which is a prestigious journal. And what the authors did is they analyzed a commercial prediction algorithm that is widely used by health systems across the US. So it is applied to about 200 million people in the US each year. And the algorithm is supposed to identify patients at high risk so they can get additional services, right? We mentioned that. Right? We use these data to direct services. But the authors compared Black and white patients, and they found that at a given risk score, the Black patients were considerably sicker than the white patients. And the bias that arose, this bias arose because the algorithm predicts healthcare cost rather than illness. But unequal access to healthcare means that we spend less money caring for Black patients compared to white. So despite healthcare costs seeming superficially to be an effective kind of proxy for health, it is not. And this resulted in a really large bias based on race. So fixing this disparity in the algorithm would result in the percentage of Black patients receiving extra health, extra services, increasing from 17.7% to 46.5%, so more than double. And so this type of thing happens more often than we would like it to happen. And it's a warning about the complexities and the consequences of health data, not just how we collect it, but how we use it once we've collected it. And this leads to another very important point. Engagement of communities in the collection and analysis of their healthcare data. It is their data is really important. Our understanding of health and social well-being can be really diverse across cultures, and it can differ from the concepts underlying the commonly used health indicators and measurement tools that we as data collectors or as the city or as a health researcher use. For example, morbidity, sickness, and death, mortality data are important, but they are what we call deficit-based indicators, which in isolation can make worse negative stereotypes and contribute to kind of internalized negativity and even racism. So let me give an example. There are high rates of sickness and death from obesity and diabetes in Latinx communities across South Texas. The negative stereotype, therefore, is Mexican food is unhealthy. Latinx people don't eat properly and are overweight. And so community mistrust arises from how data collected about them or about us reflects on us or them as a community. And so my final point is self-identification should be the gold standard. One US study showed that race and ethnicity classification on American death certificates that were determined by a funeral director misclassified Native Americans and Alaskan Natives as white over 40% of the time, compared to self-report on the current population survey. So being able to define one's own identity, both individually and collectively, on one's own terms is essential to self-determination. And you can't look at me and people look at you and make a presumption about your identity, but the only person that really knows my identity and how I perceive my identity is me. So I think this self-identification concept is really important. Looking at me, if you didn't see my picture and if you just heard my voice, you'd be like, she's British, oh, she's white. You wouldn't. I've seen the reaction, right, when I speak to someone on the phone and then I meet them for the first time in person and I can see the shock on their face. People make presumptions. You wouldn't know I was born in Nigeria. You wouldn't know I identify as African. You wouldn't know that I have 3 passports. I identify as Australian because I lived there for a long time. You wouldn't know I spent a lot of my growing up years in Wales and I identify as Welsh as well. So just by looking at someone, you can't make presumptions. Identity, self-identification is a personal thing. And so we have to give people tools to identify themselves in the way they perceive themselves. And I'll end there.
Thank you so much, Dr. Allison. I think in a very short amount of time, you did an excellent job framing the context of this problem and really proposing to us quite a great challenge that I would love to explore how this community could solve, which is exactly that. How do we build those tools that can allow people to self-identify in data collection methods and surveys so that we can paint a more illustrative picture of the various realities that people encounter, face, and experience in our community, especially when it comes to public health. So thank you. I'm going to move now to Jeffrey Howard and introduce him briefly. Jeffrey is the Assistant Professor of Public Health at the University of Texas at San Antonio. As a health demographer and epidemiologist, his research interests include traumatic injury and chronic disease epidemiology, racial, ethnic health disparities, and the environmental disaster health impacts. He has authored and co-authored over 75 articles on topics including these themes, and recent research articles have focused on how proposed changes to data products from the upcoming 2020 census are likely to exacerbate and mask racial and ethnic health disparities, and how the prevalence of cardiovascular disease among US military veterans actually differs by race and ethnicity. He holds a PhD in applied demography from the University of Texas at San Antonio, and a master's and a bachelor's in sociology from the University of Texas at Arlington. So welcome, Jeffrey.
Well, thank you very much. It's really an honor to be part of this conversation. And I'm going to echo a lot of the themes that have already been discussed a bit and so eloquently by Dr. Allison. I guess the way I would expand on the previous discussion topics is I would start it off with a question, and that is, what do we mean when we say race? And what do we mean when we say ethnicity, especially within the United States? We know that, we measure these things all the time. These things are always included on surveys, just as some of the examples that were previously mentioned. It plays a key role in the census, which you mentioned, some of my work looks at. But when we measure this concept called race and this other concept called ethnicity, and oftentimes we combine them to say race ethnicity, what is it that we really mean when we say that? And when we measure, health differences or health disparities by either by race or by ethnicity or both, what do we mean? What does that mean when we actually find differences? We know that it was not even that long ago that a lot of the medical literature in particular that would try to account for racial differences would sort of frame that discussion and the findings of that research in terms of genetic differences. But we know from, we kind of already knew before, but since the Human Genome Project completed, we know that there's no biological basis for the concept of race. So when we're measuring these things and when we talk about, differences by race ethnicity, it's important to think about, what exactly what are we measuring and what do we mean when we say there are racial ethnic differences? I would argue that race is a social concept. And I think most people are coming around to that understanding. If you go back historically, the way we think about race and the way we talk about it, and especially in the U.S., has these sort of deep historical roots, and that history is, as we know, is painful and is tied to exploitation of people, and was used essentially as a justification for doing so. So it's important that we think about, if we read materials, if we're taking a survey, if we're reading results from a study that was conducted, and they talk about racial ethnic differences, it's really important to think about what does that really mean. And when we see these differences, and this gets back to what Dr. Allison was just mentioning, are those reflective of the individual's racial ethnic background, or are those reflective of social barriers that have been erected for certain groups based on these characteristics? And so those are important distinctions. I would also echo the concern about the use and measurement of race ethnicity, especially in the context of health, as being sort of a double-edged sword. On the one hand, it perpetuates the continued use of these terms. And even the terms that we use are often imprecise. They can be inaccurate. I'll give you an example. In the census, the way the data get asked, the questions that are asked, they do ask the individual to self-identify their, what they feel like they fit with. And they give a list of ethnic backgrounds and racial categories, et cetera. And so the person has some ability to self-identify. However, when the data are tabulated, they often get put into these more rigid categories that are not necessarily accurate or precise representations of a person's ancestry, if you will. So for example, the main categories that most research uses when they use national data sets such as the census are things like non-Hispanic white, non-Hispanic black, Hispanic. Those are sort of the three biggest categories by population. But if we think for a moment about, well, what do those terms mean? Hispanic implies that the ethnic background is from Spain. But we know that that is not true. And so there's all of these groups of people who are being sort of lumped into this, overly broad category that is not really descriptive of what their real background is. And so, these are all problematic terms, the way we talk about them, the way we group people into these categories. And these have real world consequences. And so on the one hand, we perpetuate those things as we continue to collect data and process data and aggregate data in those ways. On the other hand, if we don't measure these things, then it's hard for us to be aware of where problems exist, where disparities exist. And so one of the questions that I have, it's a question for me, and I'll just pose it to the whole group because I don't necessarily know the answer, but somehow to bridge between our current conceptualization of these ideas and how we measure them to becoming more how we would just want to be described as a human being. And I would echo Dr. Allison's, one of the comments that she made about, who we are and what things are really important. What should we really be measuring about people? A lot of what we measure when we measure race is differences in access to resources. And so if we did a better job of just measuring access to resources, it might actually give us a better picture of how where people are struggling and where disparities are being created. And that has to do a lot with structural, systemic structural problems that have already been mentioned, segregation, et cetera. And so I'll just kind of leave that as some additional questions, I guess, to think about, and we can discuss further. I don't want to take up too much more time because I know there's some discussion that needs to take place. So I'll kind of leave it there with just raising those questions, and then hopefully we can discuss more later. Thank you very much.
Thank you, Dr. Howard. And it's great to hear a little bit more about how some of the issues that Dr. Wari identified are codified in the US Census, for example. And this is a tool that is widely used. It's happening now. How do we challenge some of the assumptions that are made in the way data is collected by an instrument such as that? So thank you.
Yeah, and just to echo that, I mean, the current census is really under threat right now, and it's a very big problem. There's a threat of undercount because the current administration wants to discontinue the attempts to get response. They want to cut it short, and the problem is going to be that there's going to be a significant undercount of the population. And this is likely to affect people of color, much more broadly than it does the white population. The other thing is that the Census Bureau has proposed a new privacy algorithm that some of my research has shown recently that will also mask racial ethnic disparities, particularly in health and mortality, if that algorithm is not refined before it's released. And so I really have a lot of concerns about the release of the 2020 census because it has such widespread social impacts with allocation of funding and so forth, representation of people. So anyway, that's enough about that, but it's a big issue for sure.
Certainly, thank you. So before I introduce our third and final speaker, I want to encourage everybody to drop your questions that you have for our panelists in our chat. At the very bottom of your window, you'll see a little chat icon with the word chat. Click on that and you can message anyone directly, but also the group. And please place your questions there so that we can address them at the end of our final speaker. So with that, I'll introduce Alberto Gomez. He is the co-founder and chief operating officer of IRIS, which is a technology company that improves the lives of communities through the use of technology. He's also a professor at the Faculty of Law and Social Sciences and director of Media, Society, Culture, and Technology Research Group at Universidad Autónoma de Tamaulipas. I think I got that right. He is currently a guest scholar at the Urban Future Lab at UTSA. So Alberto Gomez, please unmute yourself and share with us a little bit of your experience reflecting, I hope, on some of the technology aspects of this challenge. How do we actually address the concern that Dr. Allison posed early on regarding how do we operationalize the opportunity for people to self-identify in tools and technologies that collect data?
Definitely. Thank you, Emily, for the introduction. Of course, I want to thank CivTechSA and the City of San Antonio and every department involved for organizing these forums. I think these are important conversations, and I'm just happy to participate, along these very distinguished speakers. I think I'm sharing some slides. Are you able to see them? Yes. Yeah. Okay. Excellent. So yes, today I'm gonna speak about a project that we did a couple of years ago at the Urban Future Lab here at UTSA. And my participation was as a guest scholar, so I contributed in that position, but also participated with my company IRIS developing a tool that we use to collect localized data, right? So to talk about this project, to do this project, we selected 2 pilot communities in the south side of San Antonio. And these communities were Mission San Jose and Quintana Road. And these communities are 2 of the most impoverished communities in the nation. 1 in 3 residents living at or below poverty line, but with the proximity to a UNESCO World Heritage Site and also the Port of San Antonio, there's actually a lot of financial resources in that area. And yet both exist in environments that are not activated by the surrounded economic assets. So these communities, although surrounded by these assets, does not benefit directly from these assets. And so our research has shown that little data exists about the most vulnerable in society. And when it comes to understand the dynamics of poverty, the pilot communities in San Antonio Southside are information deserts. There's hardly any information. Like Dr. Howard mentioned, the most common data resource is the American Census, and it does not capture many of the residents' beliefs or actual. It does not represent them. And so, the closer observation that we took revealed that the lack of data informs social, cultural, and economic bias, but it also illuminates how the results of the absence of medical, financial, and transportation services affect the lives of residents daily. So to give you an example, these communities have no banks, right? And this also talks about there's also some insufficient public transportation for them to get into banks. And so by this kind of gave us a glimpse that we were able to identify that communities in the south side of San Antonio are cash-based economies, as opposed to the north communities in San Antonio are credit-based economies. And so this creates some type of parallel realities in which the south side communities or pilot communities, they based all of the transactions on cash, including the purchases of homes. And so there's actually, this information is valuable, for credit purposes, for a lot of different purposes. And since there's no information, so that talks about the information desert that we identified in these communities. And so, of course, this data is conditioned by business, political, and corporate interest, and is creating blind spots for research, policy, and the execution of these policies. And another thing that we identified is that, for us who live in other communities in San Antonio, although I live, in the south side, there's hardly any Starbucks or coffee shops, right? And this usually represents that within quarter mile, you have a lot of information because you have Wi-Fi connection spots and all these things. And so in these pilot communities, there's actually hardly any coffee shops and definitely no Starbucks around. And so, things that we take for granted that make our environment are not part of these communities. And so, just also what mirror, just to reference what Brian mentioned in the beginning, a lot of times we think that technology and consumption and that technology is the solution, but technology, however, it's never given, it is made, and it's transformation of matter and data into things. And hold on, I'm just trying to hear. Okay, so one of the things that we did in order to get closer to these communities was the collection of data. And our initial approach was to get really an authentic human interaction with people-to-people engagement. And one area that we were exploring was a hybrid engagement strategy, meaning that we wanted to get closer to the community, but also use technology in order to connect with them. I forgot about my slides, but I'm gonna go just real quickly and show them so that you can also take a look at some of the information that we were able to collect, because prior to getting to reach out to the community, we were able to collect information about businesses, the neighborhood, the infrastructure of the community, the ecology, and the geographic composition of the communities as well. And one thing that was very, very important for us was that we didn't do it alone. We had community partners when we actually went out into the field and started interacting with these communities. So we partnered with Southside first. We partnered also with LISC, which is a nonprofit financial institution. We also partnered with the Southside Chamber of Commerce, and in the tech arm we had my company. And this allowed us to really get closer to the community and have real connections with them, with community leaders. We participated in a lot of the sessions that were going on, and we really got to experience what were some of their concerns. And so the way we collected all this information is we created a mobile application in which we had a survey, and we actually had a lot of students from UTSA and community members going door to door, asking them questions about their beliefs, about what is important in their community, what do they think they needed the most. So we actually localized data and also managed to get some individualized information that allowed us to compare and to put some context to what we were able to find in the national census, which was very little in reference to the communities that we were working with. And once we collected all this information, what we did is we took the analogy of a live tree, and we did some clusters on the most important concepts that the community had. And so we were able to explain and to present this to the community and to actually look at it and discuss it with them. And they found a lot of value from having this as a reference for them to look back and have a better understanding of their community. We also created a model in which we were able to show where some of the challenges, obstacles, and things that the community had to address or that could address in order to propose something that will benefit them. And so this conversion of data into visuals that can communicate at different levels with the community, for us was really, really important and really valuable, because we got a lot of ahas, from the community, and they were able to understand finally the importance of data, right? Because when you go out in their communities and you talk about data, they don't really, know what you're talking about, and it's sometimes easier if you're able to present this idea in different ways. And so this was the case that we worked on here in the south side of San Antonio. And to that question of how do we design more inclusive data collection tools that better reflect the identities of marginalized population, I think this is a good start. You have to get close to where they are. You have to get them involved in the process. They have to participate, because like Dr. Allison said, no one knows better. No one knows better of how to identify yourself as yourself. So with that point, I think I will just conclude my participation and pass the mic to Emily.
Thank you, Alberto. What I love about that project is seeing it put into practice an attempt at allowing a community to self-identify and identify what data is actually important to them in their lives and map that out. That's a very cool project. Thank you for sharing it with us. So we have 2 minutes left before we enter into a breakout session. And it looks like we have some really beautiful and interesting engagement in the chat. I'm going to start with one question from Laura Serrano to Dr. Allison. And her question is, if Dr. Allison could share with us some tools or strategies for effective self-identification that might give individuals to self-identify in a manner that can be relevant for later data analysis. Dr. Allison, do you have any reflections on that question from Laura?
So I don't have tools for the individual themselves, because I think that's quite a personal thing, how you as a person self-identify. But I think for the people collecting the data, it's really important to recognize the heterogeneity, the differences amongst communities. And when I was doing some reading about this, I was trying to find an example within the United States, and I actually couldn't. But the example that I found was in Canada. So as you know, Canada has a fairly large Indigenous population. And so we need to recognize that one survey doesn't fit all. And so one example, and there's only one in Canada, is the First Nations Regional Longitudinal Health Survey. And what they developed that survey specifically because the data that was collected in national surveys around Aboriginal people was inaccurate. And so what that survey does is it incorporates Western and Aboriginal concepts of health. And so it's almost like a dual kind of, it's asking dual questions. But by doing that, it allows Aboriginal people to approach the questions in the way they perceive health within their culture. And so I think that is really important, that the surveys are designed for the people in a way that give people a forum within which to identify themselves, because it doesn't matter how I identify as myself, but if the survey instrument doesn't allow me to express that, that is never going to be collected. And I saw that in the chat about how people sometimes change their self-identification. They change their self-identification because they see something that fits them better suddenly, right? So for a long time, there was no mixed race. I mean, there are tons of mixed race people in the United States. There was no way they could identify themselves. So if they were mixed race, black and white, they had to pick one or the other, but why should they? They may identify equally across both. And so that's an example of why people change their race across different instruments, because suddenly the instrument allows them to express how they see themselves. And that goes the same for gender. For a long time, it was just male, female, and there was no transgender, male to female transgender, female to male transgender. There's so many different iterations of gender, and people didn't have that option. And so I think the instrument is really important.
Thank you, Dr. Allison. We're running out of time. I want to ask one more question. There's so many in the chat, and I do hate to break it off, but let's do one more and then move into our breakout session to reflect in deeper ways on some of these topics. So this one comes from Vince, and this is related to lack of participation when surveys are administered. Is it possible, are there any statistical methods whereby aggregated data, in this case, in this context from patients, could be collected that would mitigate potentially bias that occurs from lack of participation or representation in that way? And that question's for anybody who wants to take it on.
I know exactly how loaded that is. My apologies. It's just, I'm just not sure what resources are available. I'm sure y'all are more up to date with those.
Well, I have to admit, I was typing a response in the chat, and so I didn't hear all of the question, but I think it had to do with how we analyze, or what methods can be used to analyze these data. Is that basically the gist of the question?
No, I think it's more focused on just the data collection. Like, is there a way to more systematically obtain that data without the use of surveys? At this point, because that the data exists, and we could always, in order to put it into a usable format for analysis, you'll need to join it back with like 5 other sources to find a meaningful set. So I was wondering if there's any other resources available that we could use as more centralized means to be able to collect that data rather than rely on surveys.
Yeah, I mean, that's a great question. The short answer is I'm not sure how we would do that exactly, just because I mean, I suppose that you could envision like a vital records system. You know, we record birth certificates in this country. Those birth certificates are filled out, you know, when a person is born, and they're, you know, they basically go from the hospital to the, you know, usually a county compiler, you know, a county jurisdiction, and then they make their way up to federal registries. And so, you know, I suppose that, you know, and often I'm not that familiar with birth records because I don't study, I don't really spend a lot of time studying births, but I do know that those records exist. And so I suppose that, you know, just to kind of answer your question quickly, you know, it's possible that you could have a national registry of this information. However, it would be subject to whatever was chosen, you know, and put on the birth certificate. I'm not sure how else you would get systematic collection of that data at the national level for, you know, for every individual. And, you know, in the US, there's a lot of resistance to, you know, to building, you know, national registries. You know, other countries have national health registries and so forth, but we don't have that in the United States. So short answer is I'm not sure exactly how we would achieve that.
Thanks, Dr. Howard. So we have, we're out of time for our speakers. I'm going to turn it over to Leslie, who's going to direct folks into a breakout session to chat more, facilitated by Giselle Prado.
Thanks, Emily, and thank you so much, panelists. This was so educational and wonderful to hear from each of you, and really just get us thinking. I mean, that's what this is for. Get us thinking, get us talking. I think all of us are probably taking away different interesting pieces from today. So thank you so much for being here. Those who are attending and watching and listening in, I'm about to move us into a breakout room, and in there, Giselle Prado from the Health Equity Office of Metro Health will help guide us through some questions, because we do want to get a little bit more feedback from you all, what you learned today, your experiences with this. You'll be getting thrown into a different room here in just a second, and we'll say goodbye to our panelists. Again, thank you so much for being here today.